Hi, and thanks for joining me. If this is your first time here, I'm Dr. Michael Todd, a seasoned medical lab professional with over 30 years of experience in the field. Today, I want to shed some light on a group of healthcare professionals who are often unseen but absolutely essential: medical laboratory professionals. They are the scientists behind the scenes working tirelessly to analyze blood, tissue, and other body fluids. Their work guides nearly every medical decision that healthcare providers make. From diagnosing infections to managing chronic conditions, lab professionals are the foundation of modern medicine. But there's a growing problem, one that threatens the very quality of care patients receive. We are facing a critical shortage of medical lab professionals in the United States, and it's getting worse. Let's pause and ask, what would healthcare look like without accurate, timely lab results? Imagine waiting days or even weeks for your test results simply because there aren't enough trained professionals to process them. Imagine providers being unable to make life-saving decisions because the data just isn't there. That's not a future we want to face, but it's a future we will face if we don't act soon. Medical lab professionals perform diagnostic testing that affects more than 70% of clinical decisions. They work in hospitals, clinics, public health facilities, and research labs, to name a few. They're not just pushing buttons, they're interpreting results, ensuring accuracy, and often catching errors that could mean the difference between life and death. They identify infections like COVID-19, HIV, and sepsis. They help manage diabetes, heart disease, and cancer. They screen newborns for genetic disorders and support emergency rooms with rapid or stat testing. Yet despite how vital their role is, many people don't know who they are, or that a shortage is putting pressure on the entire healthcare system. Let's talk about the numbers. The U.S. Bureau of Labor Statistics projects that over 25,000 new medical lab professionals will be needed each year to meet demand. But right now, we're producing less than half that number. Retirements, burnout, and a lack of awareness are thinning the workforce. Many lab professionals are nearing retirement age, and fewer young people are entering the field to replace them. And while the demand for testing continues to grow to an aging population and more advanced diagnostics, the pipeline of new talent is shrinking. Now, this shortage isn't just a staffing problem, it's a patient care crisis. When labs are understaffed, tests take longer. Mistakes are more likely. Lives are at risk. Overworked lab professionals are often forced to work extended shifts or cover multiple roles or even delay non-urgent testing. That affects patient outcomes and contributes to further burnout, and this is a very dangerous cycle. Hospitals, especially in rural and underserved areas, are struggling to fill vacancies. Some have even had to outsource testing or cut back on services altogether. All of this puts additional strain on providers, nurses, and patients, leading to higher cost, longer hospital stays, and poorer health outcomes. So, why is this shortage happening? Well, for starters, many people simply don't know this profession exists. High school students interested in healthcare hear a lot about becoming doctors or nurses, but rarely about laboratory science. And even when students are interested, there are too few accredited training programs to meet demand. Many programs have closed due to underfunding. In addition to this, salaries for lab professionals often lag behind other healthcare roles despite the high level of education and responsibility that's required. It's a classic case of being essential yet invisible. So what can we do? Well, first, we must raise awareness. Students, educators, and parents need to know that medical laboratory science is a meaningful, dynamic, and impactful career path. Second, we need to invest in education and training programs. Funding new programs and expanding programs that already exist is crucial to building the workforce of tomorrow. Third, we must advocate for better wages, professional recognition, and career advancement opportunities so we can attract and retain top talent. Hospitals, governments, professional organizations, and the public all have a role to play because the cost of doing nothing is way too high. So what's the good news? Well, change is possible. We've seen how important lab professionals are during public health emergencies like the recent COVID-19 pandemic. We've seen them work around the clock under enormous pressure to protect public health. Now it's time to give them the recognition and the support they deserve. If you're a student, consider a career in the lab. If you're a policymaker, support funding for workforce development. If you're a healthcare leader, invest in your lab teams. And if you're a patient, and we all are at some point, take a moment to thank the professionals behind your test results. Their work may be invisible, but its impact is undeniable. Because in the end, healthcare isn't just about what happens at the bedside. It's also about what happens behind the scenes. Medical lab professionals are the heartbeat of diagnostics. They deserve to be seen, supported, and above all, celebrated. Let's make sure that they are. Thank you.